Hello everybody, Dr. Faiza Ilyas here. Today I am going to share a new lecture related to anatomy. It will be our fourth lecture. I am going to introduce anatomy today. If you like my lectures and want to get more knowledge about medical sciences, then stay connected with me. For this purpose, kindly like and subscribe my YouTube channel, that is Universal Hub. In this video, I am going to tell you the basics of anatomy. This video contains definition and types of anatomy, position and planes of human body. Anatomy. Anatomy is the basic subject of every medical field. Actually, what is anatomy is the question that always arises when you choose a medical field. Anatomy is the science of structure and function of the body. It means it depends upon two things, structure of the body and function of that organ or body structure. Anatomy has two types, clinical anatomy and basic anatomy. Clinical anatomy is the study of macroscopic structure and function of the body. Basic anatomy is the study of minimal amount of anatomy with the understanding of the overall structure and function of the body. So, we have learned about the definition and types of anatomy. Now it's the turn of learning the positions and planes of the body. First is the position. Every object in the universe has its own position. Human body has an anatomical position. So the question rises here is, what is an anatomical position? So the answer is, if a person is standing erect, upper limbs by the side, face and palms of the hand directed forward, then the person is said to be in an anatomical position. Other than position, we require planes to describe the position of the structures of the body. So naturally we have three planes. Three planes that are used to describe the human body. These planes are the imaginary lines that cut the human body into two equal halves. These three planes cut the human body by three ways into the two equal halves. The names of these planes are median sagittal plane, coronal plane, transfer or horizontal plane. Transfer plane is also called as horizontal plane. Firstly, I am going to describe you the median sagittal plane. Median sagittal plane is the vertical plane passing through the center of the body, dividing it into two equal halves, right and left halves. A structure situated nearer to the median plane of the body than another is said to be medial. A structure that lies farther away from the median plane than another is called the lateral to the other. Second is the coronal plane. Coronal plane is the imaginary vertical plane that is at the right angle to the median plane. It cuts the body into the anterior and posterior parts. Horizontal plane, that is also called the transverse plane, is at the right angle to both median and coronal plane. It divides the body into the upper and lower two equal halves. It's not enough to describe the structure of the body. We have some other terms that will describe the position of the structure of the body. I'm going to describe you all these terms in combo form. Anterior posterior in hands, palmar surface, dorsal surface. In foot, plantar surface, dorsal surface. In body, proximal and distal, superficial and deep, internal and external, superior and inferior, ipsilateral and contralateral, spine and prone. Anterior and posterior are used to indicate the front and back of the body. In hands, the terms palmar and dorsal surfaces are used in place of anterior and posterior. In describing the foot, the terms plantar and dorsal surfaces are used instead of lower and upper surfaces. With respect to distance, we use two terms, proximal and distal. The terms proximal and distal describe the relative distances from the roots. For example, the arm is proximal to the forearm and the hand is distal to the forearm. For the denotion of distances of structures from the surface of the body, we use two terms, superficial and deep. The terms superficial and deep denote the relative distances of structure from the surface of the body. The terms superior and inferior denote levels relatively high or low with reference to the upper and lower ends of the body. The terms internal and external are used to describe the relative distance of the structure from the center of an organ or cavity. For example, the internal carotid artery is found inside the cranial cavity and the external carotid artery is found outside the cranial cavity. With reference to the sides of the body, we use two terms, ipsilateral and contralateral. The term ipsilateral refers to the same side of the body. For example, the left hand and the left foot are ipsilateral, that is, they are on the same side. Contralateral refers to the opposite sides of the body. For example, the left bicep brachii muscle, that is in the arm, and the right rectus femoris muscle, that is in the thigh, are contralateral. Left and right are contralateral, left and left are ipsilateral. And the last one are spine and prawn. Two names are denoted for the position of the body, the spine position and the prawn position. The spine position of the body is lying on the back and the prawn position is lying face downward. In this video, we have learned about the definition of anatomy, types of anatomy, position and planes of the human body. All the 3D animation according to the planes and position of human body are represented in this video. If you like my video and like my lecture, kindly like and subscribe my YouTube channel, that is Universal Hub. And if you have any kind of queries or difficulties, you can ask me in the comment section.